Did you know that in the year of 2017, 10 million people have been infected with the disease known as tuberculosis, or TB for short? Now, that is 1/4 of the world's population. Approximately 1.3 billion people have actually died from this disease. My name is Priscilla Garza, and I am an LVN, and I am here to demonstrate how to administer a TB skin test. Now, a TB skin test is very important because it does determine whether or not a person is positive or negative for tuberculosis. Tuberculosis is a disease that approximately affects the lungs. Now, it can affect other organs such as the brain, and it can end up spreading down to the spine and eventually cause death. So with the TB test, there are different forms. There's not just the skin test. There's also a chest x-ray. There's a blood test. There is a sputum test as well. The TB test is the most commonly used test, mainly because it can be used on all kinds of clients, whether it be infants, pregnant women, or those chronically ill. It doesn't cause any kind of harm to anybody, and that's why it's mainly the most common test that we use to determine whether or not a person is positive or negative. So to begin with the process, being a medical professional, you want to make sure you have the correct items, and by items I mean you want to make sure you have your equipment, of course. But you also want to make sure you have an order or any kind of form stating that this person is needing a tuberculin test. So like the order I have displayed here, I have my patient, John Doe. I have the address, the ordering doctor, and then the order to administer the PPD test, which is the TB skin test. Now that we have everything, we want to make sure we verify the name and date of birth with our client. We want to make sure they don't have any allergies, and if not, then we can go ahead and proceed to gathering our materials. Our materials do consist of a tuberculin syringe. Our needle measures at 25 gauge needle with a length of 5/8 of an inch. We have our alcohol pads, and of course our vial with medication, or not medication, but a solution. The solution that the vial contains is a purified protein derivative, meaning it is similar to the actual strand of TB, and it's not going to infect the person. It is just going to help us determine whether or not the person's skin has a reaction to it, which again determines the positive or negative testing. Now, this vial contains 5 tuberculin units per 0.1 mLs, which is the 0.1 mLs is what we are going to end up administering. So I do not have an actual client, but I do have a skin simulation pad. So this is pretty equivalent to the human skin. It does have a lot of punctures, again, from nursing school, so bear with me. The solution might end up squirting out. So when picking a spot to administer this medication, we want to make sure we pick the forearm, whether it be the left or the right, it doesn't matter. You just want to have a area of skin that is free of veins or arteries. This injection goes intradermally, meaning it goes into the top layer of the skin. So with that being said, we asked our patient for their name and date of birth, any allergies. We're going to ask them to remove any clothing, like long sleeves, or just roll them up. If they have a jacket, we want to, obviously remove that jacket. We want to ask them to just stretch their arm out in front of them, just nice, calm, relaxed. And with that being said, you stretch the arm in front of them, the skin has a nice taut to it, meaning no skin flaps, nothing to obstruct the area. With that being said, we are going to, of course, wash our hands, put on gloves. Now, I do not have gloves at this time, but we'll just pretend that I do. I'm going to take an alcohol pad. I'm going to just clean the area. And we'll let that air dry. Then I'm going to take my vial of solution. This is a new vial, so I'm going to take off the cap. And with another alcohol pad, I'm just going to scrub the top. Okay. And we'll let that air dry. So we're going to take our syringe. This is a tuberculin syringe. Normally, these are capped with red caps, meaning they are specifically for TB testing. So with this, our syringe is numbered. So we're going to drop back to 0.1 mLs. We're just drawing back the air. We're going to then uncap the needle. Then we're going to insert the needle into the vial. Inject the air. Flip the vial with the needle inside. And we're going to draw back the 0.1 mLs. Now, if you have a little bubble at the top, that's okay. You can always draw back more and eventually just push it back into the vial until you get the 0.1, like so. Okay, so we're going to then flip the needle. Now, most needles or syringes come with a safety guard, like mine. So if you are preparing this outside of the room, you can just slide your safety guard back up and then take the syringe back into the room. If not, you can always use the one-handed scoop method, like so, and then just snap it on. Okay, so we go into our client's room, or, you know, like I said, we prepare this in our client's room, so their skin is already dry from that alcohol pad. We're going to now ask our client to just stretch out their arm, and we're going to just taut their skin like so. We want to, again, make sure the area is free of any kind of vein or artery. So it is important when you are administering this or inserting the needle into the skin, you want to make sure you go in at a 10 to 15 degree angle. And you don't want to insert the whole needle in. You just want to make sure that the bevel is in. So the bevel is the little hole at the top of the syringe or the needle. And that needs to be facing up when you are administering. So, like I said, we're going to taut our skin. We're going to go in at a 10 to 15 degree angle. We're going to go in just enough at the top layer of the skin. We're going to push the plunger and administer the solution. Now, a wheel should end up popping up like so. That is normal. That is good. That's what we want. Now with that wheel, when that wheel pops up, we want to make sure we withdraw the needle in the same position that we inserted it, like so. So as you can see in my wheel, that is how you administer a TB test. So once we have our wheel, we want to make sure we don't massage the area, we don't put a band-aid over the area, we don't touch the area. We want to wait about 30 minutes to see if our client has any kind of allergic reaction. Any kind of localized swelling or redness should appear within the first 24 to 48 hours. We want to instruct our client to come back and see us in approximately 72 hours. This is when the test is to be read and determined if it is positive or negative. Now, a positive test will appear as a hardened, red, swollen area. It has heat to it. In that case, we would do a secondary test, and which would be the chest x-ray. If it is negative, the wheel will eventually go down and the arm will appear normal. After the TB test is administered, as a medical professional, you want to make sure you document which arm you gave it in, the date that you gave it, and the time that you administered the solution. Like I said, the TB test is highly important. It's just a screening to see whether or not you test out positive or negative. Again, anybody can be a part of that 10 million big number of people who have been affected. You know, just by not doing this, you can easily be a part of the 1.3 billion people who have passed away from TB. It is a very serious thing. It is highly recommended that those in the community do take the precaution and get tested for tuberculosis. Again, my name is Priscilla Garza, and I hope that you have learned something from the importance of doing the TB test, and I hope you have learned how to administer a TB test. Thank you.